Welcome to another episode of FSD Doctor Talks. I'd like to talk to you today about something that almost never hurts, almost never causes symptoms early on, but is now one of the fastest growing causes of liver failure and liver transplant worldwide: fatty liver disease. Or now, as professionals call it more accurately, metabolic associated fatty liver disease, or MAFLD. Because this condition is not really about alcohol, it's about metabolism. And most people with it have no idea they have it. Let's start with the basics. Your liver is supposed to store a small amount of fat, that's normal. But when more than about 5 to 10% of the liver becomes fat, we call it fatty liver disease. At first, this is just fat, sitting quietly in the liver cells. No pain, no symptoms, just normal life. And this early stage used to be called NAFLD, or non-alcoholic fatty liver disease. But we've moved away from the term because it defines a disease by what it isn't. The new term, metabolic associated steatotic liver disease or fatty liver disease, and that name matters because it tells us what's really driving it. Now here's the critical progression. Fatty liver is not one disease, it's actually a spectrum. First, simple fat accumulation, then inflammation, then scarring, and then cirrhosis, then on to liver failure or liver cancer. That inflammatory stage is called steatohepatitis, or fat plus inflammation, previously called NASH, which is non-alcoholic steatohepatosis. Now it's called metabolic associated steatohepatosis. This is the dangerous turning point because once inflammation starts, the liver begins to lay down scar tissue, and that scar tissue does not reverse easily. So let's get down to the early stage. What causes this in the first place? This is not about alcohol in most people. It's driven by, you got it, insulin resistance. High insulin, high glucose exposure, excessive energy storage, and poor metabolic flexibility. The biggest drivers for these are excess visceral fat, central obesity, type 2 diabetes or pre-diabetes, high triglycerides, low HDL, which is your good cholesterol, high fructose intake, and obviously ultra-processed foods associated with a sedentary lifestyle, and to top it all off, poor sleep and chronic stress. And here's the key point that surprises people. You don't need to be overweight to see fatty liver disease. We see fatty liver in lean patients all the time, especially people from the Southeast Asian background or South Asian. If you're insulin resistant, your liver pays the price. Now let's talk about the warning signs, or more accurately, the lack of them. Most people with fatty liver disease feel fine. No pain, no nausea, no jaundice. Maybe some vague fatigue, maybe some mild right upper quadrant or upper abdominal pain, if anything at all. And that's why it's ignored. And often the first clue comes incidentally. Someone orders an ultrasound for looking at gallstones or some vague abdominal pain, or just on a routine blood test, the report says increased echogenicity consistent with fatty infiltration of the liver. That single sentence has been casually ignored for decades. Oh, it's just a fatty liver. No follow-up, no risk stratification, no plan. The problem there is that ultrasound only tells us that fat is present. It does not tell us how inflamed the liver is, how much fibrosis there already is, and who is at risk of progression. You can have normal liver enzymes and still have advanced fibrosis of your liver. Let me repeat that. A normal ALT or liver enzyme does not mean a healthy liver. So why does fatty liver progress in some people and not in others? Several things accelerate progression. Ongoing insulin resistance, poor blood sugar control, high fructose intake, that is sugar drinks, rapid weight gain or loss of muscle, sleep apnea, and obviously alcohol, which adds insult to injury. So alcohol on top of the metabolic disease, and some part play by genetics. And alcohol, just so you know, doesn't have to be heavy here because it's already dealing with a scarred liver. In someone with fatty liver disease, even moderate alcohol adds fuel to the fire. Fat plus inflammation plus oxidative stress means scarring. Now let's talk about the consequences, because this is where things get serious. Now, metabolic associated fatty liver disease is now one of the leading causes of cirrhosis in Australia, in the US, and in Europe. It's becoming the top indication for liver transplant. And you know, once cirrhosis develops, portal hypertension, fluid in your tummy, you start throwing up blood, then changes to your behavior, which is called encephalopathy, and consequences such as liver cancer. And the scary part is, people can develop liver cancer without even being diagnosed with cirrhosis first. This is no longer a niche liver condition, guys. This is a metabolic disease with liver consequences. So, you might obviously ask the question, why has this been ignored for so long? Because it's silent, because it progresses very slowly, and because it overlaps with obesity, diabetes, heart disease, and because we treat the numbers and not the root cause. Because for years, we didn't have a clear framework. Now that's actually changing. The new terminology actually helps a lot, and it matters. So metabolic associated steatotic liver disease and metabolic associated steatohepatosis, this reframes the condition as a part of the metabolic syndrome. So it's not just a liver problem alone, a whole body energy handling problem. So what should people do if they're told they have a fatty liver? First of all, don't panic. Second of all, don't ignore it. This is one of the most reversible chronic diseases we see if it is caught early. The most powerful interventions for this are not medication. They are, you might get sick of hearing this, improving insulin sensitivity, reducing visceral fat, preserving and building muscle, and improving metabolic health. Weight loss helps, but how you lose the weight matters. Crash dieting, muscle loss can actually worsen the outcomes. Protein intake very much matters. Resistance training matters. Sleep matters. Alcohol reduction matters. This is not about starving the liver. It's about restoring metabolic balance. Medications like GLP-1 agonists, they show some promise, especially when diabetes is present. But they're actually adjuncts, they're not the magic bullets. There is no pill that out-exercises poor sleep, ultra-processed food, and inactivity. So if you take one message from this episode, let it be this. If you've ever been told you have a fatty liver, even once, even years ago, it deserves attention. Not fear, not shame, but respect. Because fatty liver disease is not benign, and ignoring it is no longer an option. Thank you for watching FSD Doctor Talks. The car drives and I guide you. If you found this helpful, share it with someone who's been told, oh, it's just a fatty liver, because it's never fat. It's a signal. Thank you very much.